Okay. So before I introduce our presenter today, I just want to put a little plug out for the Buddy Walk. It is coming up very soon, sooner than I think, October 18th. It's from 11 to 2 at Hazelwood Green. We are so excited to be at this new venue, and there's still time to register teams. If you are not interested in having a team but still want to come, please come. Just go on our website and sign up and come. We'd love to have you. We have lots of events and fun things happening, resource fair. So there's a lot of things. So please come. Please, I can't wait to see everyone. So now I want to introduce Shannon Frizzell. She is the registered dietitian at the Down Syndrome Center, and she provides accessible, inclusive nutrition counseling to patients with Down syndrome of all ages. So I will hand this over to her, and then she will take it from here. Thanks so much, Shannon.
Yeah, yay. Thank you, Charisse. I am so excited to be here today. So great to get to meet everybody. Let me share my slides. Perfect. Yay. And we'll put this in. Okay, we can see everything, right? Okay, good stuff. Perfect. Yay. Well, just like Sheree said, I am the registered dietitian that works at the Down Syndrome Center here in Pittsburgh. So, what I'm going to do with this presentation today, I'm going to talk a little bit about my role there and what working with me looks like. And we're also going to talk about some common nutrition concerns that I see get referred to me by the doctors a lot and some things that we do to address them. So to get started with all this, I feel like I kind of just went through these a little bit. Can skip that. So a little bit about me, just since I don't think I've gotten a chance to meet everybody just yet. So I am originally from Pittsburgh, Pennsylvania, and graduated from the University of Pittsburgh. I have been with the Down Syndrome Center since 2021, so a little over 4 years now. When I first got started at the center, I was just seeing the adult clinic patients, but now I see patients of all ages at the Down Syndrome Center. I'm also a member of the Down Syndrome Medical Interest Group, and I am on probably way too many committees. So if there's ever more like education opportunities that you guys are looking for, I definitely have a lot of involvement there if there's ever anything we're interested in learning about. A little bit about me personally. You can see that picture I have there is me and my husband Gavin from when we were kayaking in Alaska earlier this year. We've been married for almost 3 years now. Holy moly. And then, of course, had to include my cute little potatoes, my dogs, Maverick and Pumpkin, who I was like, oh, if I include the dogs, I have to include my husband in here too. So like maybe I was telling Charisse before too, if you make an appearance at the Body Walk, you might be seeing one or two of them there also. But that's just a little bit about me. I like to play softball, I like to run, I like to take my dogs to the park. All right. So, what is a registered dietitian? I feel like this is something that's important to highlight because not everybody has met a registered dietitian or worked with one before. So, just to kind of highlight like all of the education and experience that goes into becoming a registered dietitian. So, registered dietitians or registered dietitian nutritionists are nutrition experts. We have to complete a minimum of a master's degree in terms of our education. We also complete at least 1,000 hours of supervised practice experience, in addition to needing to pass like a national boards exam. Depending on what state you practice in, you also may have to pursue additional licensure requirements, which I do believe, at least I think in Pennsylvania, that that still is a requirement, but that might have changed. Um, I like to highlight that as far as like registered dietitian or registered dietitian nutritionist, that is a protected title, but the term nutritionist is not like a medically protected title. So somebody can say they're a nutritionist without having gone through all of this like very vast educational and practical experience. So whether you're working with me or if you're looking to work with another nutrition professional, looking for that like registered dietitian title is something that's pretty important just because there can be some like loopholes in there in terms of like education and what titles are considered protected. All right. So what does working with me at the Down Syndrome Center look like? It definitely looks different from person to person, but just to talk about it a little bit. So I complete most of my appointments virtually, especially thinking if any of you have ever taken your loved one or your child with Down syndrome to an appointment at the Down Syndrome Center. You know those appointments take a really long time. So sometimes going through your entire appointment with the doctors and then sitting for another entire appointment with me is just a little bit too much for one day. So I do a lot of my counseling virtually, but if you did want to meet with me at your Down Syndrome Center appointment, this is something that you can let the center coordinator know or let your doctor know, and we can always try to make that happen too. So, initial appointments or the first time that I'm meeting with the patient or family usually is more for just getting to know each other. Since I usually don't meet everybody in clinic, it's nice for us to take a little bit of time, get to know each other, and just learn about like what our goals are and what's important versus actually working towards like setting specific goals and beginning to implement them in that first appointment. I think that's sometimes a surprise as I work with new families. We think like, oh, we're meeting with the dietitian. We're going to leave with like a whole game plan today. We're going to leave with all of these steps to follow or a specific diet to follow or something like that. That's not usually what it looks like as working with a dietitian is an ongoing process as we work to, make changes to our diet, implement nutrition and physical activity goals. That's stuff that takes a long time to make those like lifestyle changes. So, depending on what your goals are, you might be seeing a lot of me. You might see me actually more often than you see the doctors. I have some of our patients that I meet with once a week, some I meet with, once a month or every few months. I have patients I've been working with at the center for multiple years now. So really kind of depending on what our goals are, just might look a little bit different than expected. I also like to highlight that I view goal setting as something that's definitely to be driven by the individual. I try to prioritize promoting independence in our folks with Down syndrome as much as possible, and definitely like putting that at the forefront of how I conduct appointments. All right, so we'll get into a few of the most common like referrals that I get from our doctor or nutrition concerns that I see and ways that we go about addressing that. All right. So, starting off with feeding and swallowing difficulties. So, I feel like I see this most commonly in our pediatric patients, and that's kind of what we see as we review research too, that feeding and swallowing difficulties might be present. We also might see this in the adult population as we're aging, or if we have any like signs of like dementia setting in. So, while it's more common in the pediatric population with Down syndrome, definitely seen like all across the lifespan. So something that's pretty common. Um, in some very rare cases, nutrition support might be indicated via tube feeding. So that's also something that I do. I feel like a lot of people don't know that we think dietitian, we think weight loss, but I do also do things like calculate nutrition needs for tube feeding. As we work towards addressing feeding and swallowing difficulties, I like to highlight that this is a really, really, the importance of collaboration between the dietitian, the speech language pathologist, the OT, the doctor. So as I work through these challenges, I always say like very open to collaborate with any other professionals that my patient is working with. If that means like talking with their feeding therapy team or talking with their like primary care provider, like always very open to collaborating in that way since there are such unique roles for everybody as we address these concerns. I like to highlight that as the dietitian, I will not make a recommendation for like a texture modified diet. So if somebody needs like thickened liquids or if somebody needs a more puree consistency diet, those won't be recommendations that come from me as the dietitian. That's not necessarily like what my lane is. That would be more of like the speech language pathologist to assess that like safety of swallowing and make those texture recommendations. But where I come in is how we can improve the nutritional quality of whatever that texture modified diet is. So if that means like identifying ways to add variety or identifying ways to add calories or add protein, that's kind of where my role comes into that. All right. So, selective eating and limited diets. I feel like we get a lot of this also in our pediatric population. Very common referral that I get from our center psychologist, Taryn, that I think if you've been attending these lunch and learn events, you probably saw a little bit of Taryn earlier this year. Um, so where we come in here, when we say like selective eating or limited diet, kind of mean like a patient self-limiting their diet. So it's not necessarily like picky eating. I think picky eating is something that we see like very commonly in, all kind of kids as they grow up, no matter what their age group is. What we're talking about when we say like selective eating or a self-limited diet is a little bit more involved than that. So this could look like maybe a person that only eats from two food groups or only eats like a total of six or seven different foods. Or maybe they only eat foods of a specific texture or color, like those specific preferences like that, that makes their diet very limited. So not just like regular picky eating of like a, oh, well, I don't want to eat that today, but I liked it yesterday. Or, I like all of these vegetables, but I don't like broccoli and cauliflower. So this is a little bit more involved than that, where we're really limiting to maybe like less than 10 foods or to only a couple food groups. We see this more commonly in our kiddos that also have a diagnosis of autism spectrum disorder. So we might see that those like texture and color preferences come in a little bit more when we have that dual diagnosis. As far as what medical nutrition therapy looks like when I work with patients with selective eating, we really try to add variety gradually in a way that is going to be like promoting the most positive experience for the patient. Um, this can be a little tricky, and I feel like a lot of times when I do these appointments, parents will ask me like, well, how do I know like how much to change or how do I know what to try? And I really try to encourage like, parents know their kids better than anybody else. So like understanding like as a parent or caregiver, like what level of change your kiddo might be willing to tolerate is usually a good place to start. But as far as goals that we set, we try to introduce one new food every 1 to 2 weeks. Sometimes that's not always how it goes. Maybe we go a little bit slower than that. I feel like most times we go a little bit slower than that, but that's absolutely okay. Our kiddos take their time and as they want to, and still working towards the same end result. So however long it takes us to get there. All right. So as I work to address selective eating habits, we really utilize that like power of visual aids. But also like the involvement of like our kiddos in the kitchen and any kind of like, anything that we can get them involved in as far as like food prep or grocery shopping or meal planning, snack planning, any like ounce of involvement that we can get them to participate in, I really think goes a long way in terms of, decreasing our anxiety around food, decreasing our anxiety around trying new things, opening up that like world of acceptability just by, not necessarily like eating things right away, but how can we like experience that participation in like just trying new foods, being around new foods eventually, as we get more comfortable with that part of the process, maybe we'll work our way towards trying something new in terms of like eating a new food. All right. So I kind of alluded to this as we talked through it a little bit already, but the process of introducing new foods, at least the process that I use, is referred to as food chaining. So how this works is we basically just go down a food chain. So how we start is we pick a food that is already accepted. So we think about a food that the kiddo already likes to eat. And we think about the characteristics of that food. Like what color is it? What texture is it? What temperature is it usually served as? So we start with something that they like and we think about those characteristics. And we think about how can we make a very small change to that the patient is likely to accept. So kind of going back to trusting our instincts as parents and caregivers, the people that know our kiddo the best will oftentimes know what level of change are they going to be willing to tolerate. And important to note too that like sometimes we get it right and sometimes we get it wrong. Sometimes we make a change that was a little bit too big for them and they'll definitely let us know. But moving to the step three, hopefully our change was just right and we did get them to accept trying something new. And then we can continue to build off of that by making additional changes that we think they'll accept. But kind of like we alluded to before, if we make a change that was maybe a little bit too big of a difference or too fast of a change, we can always kind of go back and make a little bit of a smaller change. So the example that's over here goes through, I'm sure, a lot of our kids' favorite food. We start with chicken nuggets over here. So going from like step one are fast food chicken nuggets to how can we make such a small, tiny change to this? To where maybe we go from fast food chicken nuggets to store-bought chicken nuggets. And maybe I feel like to a lot of us, we think like chicken nuggets are chicken nuggets. Like this isn't really that much of a change. They're still only eating one thing. Whereas to our kiddos with Down syndrome, especially if we have maybe some of those added sensory challenges, if we have a dual diagnosis of autism, or whatever it might be, that small change from our fast food chicken nuggets to store-bought chicken nuggets is probably very noticeable to them. Some of you might have kiddos with Down syndrome that you're like, if I buy one brand of something and I change the brand or the grocery store was out of the brand I usually buy, they'll be able to tell the difference and they'll let you know. So I think it sounds like not that big of a change, but as we think about introducing new foods, know that every small thing we change like is a pretty big deal. So I kind of try to celebrate all of those wins as much as possible. Like any new thing that we try absolutely counts as a new food added to our list of foods that we're willing to accept. All right. So moving on from there to celiac disease, which is, I feel like, another very common referral I get from our doctors and something that we see again all across the lifespan. So we see kiddos with Down syndrome dealing with celiac disease, and we also see this in the adult population as well. Definitely more common in our folks with Down syndrome, and a big opportunity for us to implement nutrition changes to help our person with Down syndrome feel a little bit better. So, celiac disease is just an allergy to gluten. So, when we think about like possible symptoms of that, we'll usually see GI symptoms. So, complaining of like constipation or diarrhea, bloating, abdominal pain. We also might see some like irritability, behavior issues, or maybe like not wanting to participate in activities that we used to really enjoy. We might feel more tired. We might see, as far as lab results, we might see anemia show up on lab work, specifically like low iron levels or low B12, just with how that ingestion of gluten impacts our GI tract. So, with the ingestion of gluten, we'll see inflammation of that GI tract, which makes it more difficult for us to absorb our nutrition, leading to those vitamin mineral deficiencies that we see listed, also potentially leading to some unexplained weight loss. I feel like that's an important thing to highlight because in our Down syndrome population, I feel like we see a lot of people like across all ages struggling with overweight and obesity to where sometimes that unexplained weight loss gets overlooked. We think, oh, like We don't know why, but they lost weight, and that's a good thing. And in reality, if we don't really know the reason for the weight loss, usually we want to dig a little bit deeper and see if there isn't something going on there that should be addressed versus just being happy that the person is losing weight. So as far as medical nutrition therapy for celiac disease, it's lifelong strict avoidance of gluten-containing foods and products. So depending on a lot of factors, I feel like this, when we say like strict avoidance, we mean like avoiding gluten-containing foods, avoiding gluten-containing medications, avoiding like cross contact. So like separate cooking surfaces for gluten-free foods so that we're not getting any of that cross contamination. Because even if we're not seeing like severe GI symptoms, we're still having that inflammation, which is, uncomfortable or potentially leading to these vitamin mineral deficiencies. So very important that we do like keep that strict avoidance as best as we can. I think it's also important to note that as we get this diagnosis of celiac disease and we implement a gluten-free diet, that we might see weight gain as a result of that. So that's a very common thing to happen. I feel like most of the patients that I work with, when we start following a gluten-free diet, we will see a little bit of weight gain. So completely normal thing to happen. And the reasoning for that is if we think when we were ingesting gluten and we weren't able to absorb all of our nutrition before, the second that we fix that, and now our GI tract is happy with us again, and we're absorbing all of our nutrition and getting all of those good nutrients from our foods that we're eating, we'll see some of that weight come back on. So even if we didn't see unexplained weight loss in the beginning as a result of not following a gluten-free diet, it's still possible to see unintentional weight gain as we initiate a gluten-free diet. Okay. As far as providing education for gluten-free diets and how I go about this, we try to be as visual as possible, which is definitely difficult. And hopefully we'll have some better resources for this coming out in the future because these aren't my super favorite handouts, but I think at least still good resources as we're familiar with some of the concepts. I like this idea of the celiac traffic light diet just because a lot of us and our patients with Down syndrome too, most of us are familiar with what the lights on the traffic light mean. Like the red means stop, so maybe those are foods that we don't want to have. Maybe those are foods that would be dangerous for us if we're looking at the traffic light guide in terms of celiac disease. Same thing with like the yellow on the traffic light. We know that that means slow down. So as far as that middle category, okay, these are foods that might be okay, but they also might not be okay. So maybe we want to double check on the nutrition facts label or be looking for this certified gluten-free symbol as far as those yellow foods because they might contain gluten. And usually we know green means go, so that whole list of green foods there is going to be foods that we don't really have to worry about in terms of them containing gluten or not. So it's just like a fun way to break it down, something that we're all pretty familiar with. So I like that as a resource, but definitely a lot of other resources out there for more information. Okay. So overweight and obesity, I feel like this is probably the most common referral that I get in both pediatric clients and in adult clients. Probably as I work with patients at the Down Syndrome Center, maybe like 90% of the patients that are referred to me are due to overweight and obesity concerns. So, what do we know about it? We know that both youth and adults with Down syndrome are at higher risk for overweight and obesity when compared to people without Down syndrome. A lot of different factors go into that and the reasonings for why that is the case. Just to highlight a few of them, we know that hypothyroidism is more common in our patients. Also, we have lower muscle tone, decreased metabolic rate. Also, some social considerations that we'll get into here in a little bit. And also, we have some barriers to implementing traditional strategies for weight loss. So, when I think about counseling for overweight and obesity, as I work with our folks with Down syndrome, something like a calorie counting app, is not something I would typically recommend. Like I have a few patients that are able to use that, but as far as a lot of our folks with Down syndrome, it's not going to be a tool that's like that they find very helpful. So I like other tools like there is an app I like called the 8 Food Diary that is more of a visual app where you like take a picture of the food that you're eating and it will ask you questions about like why are we eating? Am I feeling hungry? Is this, a food that makes me feel happy? Am I feeling bored? Like, what's our reasoning for that? So that we can think a little bit more and have a way to kind of hold ourselves accountable for like the choices that we make, but in a way that's more visual and easier to use than like a calorie counting app. So thinking about also, like using nutrition facts labels might not be something that I regularly recommend as I work with folks with Down syndrome, or like only highlighting specific information on the label. Like maybe we only look at the serving size and maybe that's the one thing we practice. So thinking about how we adapt those traditional strategies into ways that our folks with Down syndrome are going to find most helpful for them. So, as far as research for recommendations, we don't have a ton of stuff out there, but we have a little bit. As far as our recommendations for adolescents, I want to say this study was for intellectual disability in general, but had a lot of folks with Down syndrome included in the research. We see some evidence supporting this enhanced stoplight diet approach. So, I'm thinking maybe some of us are possibly familiar with the traffic light eating plan. If we're not, I'll talk about it a little bit. Kind of going back to, we just talked about this with the celiac traffic light too, but sticking with that like concept of the traffic light because it's something familiar that we already have a good understanding of so that we can more easily like adapt it and understand. So when we look at our enhanced stoplight diet approach, as we look at the green on the traffic light here, same thing as before. Like we know green means go. The foods in this green category are foods that we want to make sure we're eating a lot of. We want to try to get these foods in our diet every day. We go down to the yellow on the traffic light. We know yellow means slow down. So we think about, okay, you know, fine to include these foods in our diet regularly. Maybe it's just not something we want to have every day. Maybe we try to have these foods once or twice a week because they're going to be lower in nutrient density than the foods in the green category. When we say nutrient density, we're thinking like in terms of like vitamins, minerals, protein and things like that. Like so the nutrients that our body really needs, our yellow foods are going to be lower than our green foods. As we go down to the red category on the traffic light, we know that red means stop. So we think, okay, maybe I want to think before I have some of these foods down here in the red category. Absolutely not saying to like get rid of these foods or that they're bad foods or anything like that. I think really highlighting the difference between like red does not mean that this is a bad food. Red just means that this is a food that we like really slow down a little bit and we only have sometimes. So including all of these foods is how we really like formulate a healthy diet. Like everything fits in there. It's just how often do we think about having these things? So, to enhance this traditional stoplight, the approach that was used that we see some evidence for helping our folks with Down syndrome is we try to stick to this traffic light diet like we try to stick to it at least like 70–80% of the time. And the times that we're not sticking to the traffic light, we go to a pre-portioned meal. So something like lean cuisine or like a healthy choice meal, something that is like an easy preparation so that the individual themselves can really take ownership in that. Like it's something that's easy to prepare, so likely they can pretty much do it on their own, maybe just with some encouragement to stick to the plan, but that it's also already portion sized, like out for them. So we're not worrying about overconsumption or having too much. We've already kind of like taken a lot of the like extra steps out of it. So if we don't feel like building our own meal that's in line with what the traffic light diet says, we'll just go to having some kind of like pre-portioned meal that like is a little bit lower in calories, but still has some kind of good protein and balance there. So not a ton of research, but looks like we're getting a little bit more as the years go on. So hopefully when we do this presentation again, have a little more to say. All right. So continuing with overweight and obesity, I know we talked about before, like lots of considerations and factors that go into like why we see this be a more significant problem in our population. I always like to like think about these additional considerations as I work with our patients. So one, thinking about like what does their living situation look like? Meaning what do their supports look like at home? Who does grocery shopping? Who does meal prep? Who's involved in all of these things, and also how can we like prioritize the patient involvement. I think as we work towards goals for like nutrition goals for managing overweight and obesity, a lot of this is really like lifestyle changes. So kind of going back to these aren't changes that we make overnight. It's not something that gets solved in one appointment. It's something that we're going to continuously be working on. So I really want to make sure that the person I'm working with like feels their voice is heard. Like we'll usually go through like assessing like motivating factors. Like this is something that maybe do in a first appointment or a second appointment before we work on any specific goal setting to address overweight and obesity or work towards specific weight loss goals. We think about like, okay, let's go through some questions so that we can figure out like what is important to this person I'm working with so that that they feel a little bit more invested in the lifestyle changes they're making. Feel like it's important to think about it that a lot of the times when I'm working with a person with Down syndrome towards overweight and obesity goals, like we're working towards weight management goals, it's usually not them themselves that initiated the appointment. Usually the appointment was initiated by like a parent, caregiver, like obviously someone who loves them a lot and wants to see them live a long, healthy life. But feel like sometimes sitting down with a dietitian as the person who didn't initiate the appointment, it sometimes doesn't always feel like a positive thing. Where I've had some of our patients tell me before, like, oh, when my mom first told me I had to meet with a nutritionist, I thought this was a punishment. And I was like, oh no, I hope that no one feels that way. It's definitely not what my goal is. And eventually we turned her attitude around and she's like, but you are the best nutritionist. I love talking to you. This is so fun. And that's really like the absolute goal of like how I want people to feel as we work through these appointments because we're going to be working together for a while. I want them to make sure that like they feel that their voice is heard. So we'll ask questions in these appointments as we address motivating factors how do we feel about how our clothes fit? How do we feel about our body image? Do we want to improve our self-esteem? Do we have any specific like activity or sports goals? Like what sports do you play and is there something you want to get better at? Do you simply want to prove to yourself that you can do things are hard? Like all kind of answers we get as we go through these questions. And I think being able to keep those motivating factors in mind as our patients work towards weight loss goals is something that really helps them to be successful. Like changing the frame of the appointment from this is something that, my parents are making me do to, oh, this is something I get to do for myself because I see what all of these goals are of mine and how they all like align with what we're talking about. So I feel like it kind of like knocked off a couple things from this list there. I wanted to highlight too, we're seeing that GLP-1 and just medication management in general for overweight and obesity is something we're seeing a lot more of, just more commonly used in the Down syndrome population. So if this is something we ever have questions on, I do have a lot of experience outside of Down syndrome working with these medications. But as far as working with our patients that take them, I've seen some pretty positive results. So I feel like we see folks with Down syndrome maybe really struggle with those like hunger and fullness cues. I mean, for physiologic reasons, but also sometimes it's just not a concept that's very easily visualized. Like our folks are such powerful visual learners that when we talk about well, how does your body feel and how do you know when you feel full? That sometimes that like abstract concept of mindful eating is a little bit of a challenge. I feel like a lot of people can relate to that actually. But it's one of the reasons I feel we see these medications maybe be if more effective is it really helps us to think about like how our body feels because we'll feel fuller more easily and be able to kind of tune into that a little bit. So something that we're more commonly seeing used. I feel like we definitely highlighted goals to promote independence there. Very important to me. All right. Talked about this a little bit already, trying to use a lot of visual aids as our teaching tools. So when we think about like this little picture of the plate that's at the top here, thinking about using like a divided plate, I've had this question like, is this something that's okay to use? I think it's absolutely something that's okay to use. Again, kind of going back to that independence piece, is it something that the person themselves like feels comfortable using? Is it a tool that's helping making nutrition changes easier for them? If like the pictures in the sections, I like that a lot to help the person know like, okay, what foods go in this section? What is the portion size for the food that, goes in the fruit category or the what portion size should I have for my vegetables or how do we build this plate? When we think about using like a divided plate, I think it's important that parents, caregivers, as we like work towards like as we decide like, okay, I know how to portion out a meal. I know what the recommended portion size is for this, like as the parent or caregiver, teaching that to our, loved ones with Down syndrome too, so that these tools eventually become something that they can use independently or as independently as possible, not something that we get in a habit of doing for them because then they're not really like learning like why or how much. I feel like in my appointments a lot I'll ask like, well, how do you know how much to have at a snack? And I get the answer of, well, I don't know. I don't really think about it. It's like, well, there we go. Like, that's a good point. Like, it's a good self-realization of like, huh, that's not something I really think about. So as much as we can, again, like encourage that involvement in meal prep or snack prep or whatever it is so that, we can learn to visualize what those recommended portion sizes look like. I think those are really great tools to boost some independence also. Going down here to another visual of the plate, kind of just showing like one that we have that's okay and one that I like a lot better. So this one over here on the left, like we can see like it's okay. It's got a few pictures on it. It's got some color coding. Like we could maybe kind of guess like what foods belong in those sections and how much of them to have. But I really like this one over here. Basically just taking that same plate and how do we make it way more visual? How do we offer like so many more like options so that we can really see like what foods go where and how much should I be having. All right. So moving on to another set of common referrals that I get. So we see a lot of GI issues. I know we talked about some stuff earlier, celiac disease. We might see that manifest in GI issues, but also I think our other two big ones is we see constipation pretty frequently and we see reflux pretty frequently. So I'll start with thinking about reflux a little bit, just since I feel like it piggybacks off of some of the things we were just talking about. Because we'll see reflux worsened with specific foods, but we'll also see it improved with some of those mindful eating habits that we had just talked about. So, thinking about portion sizes and being more mindful of weight management goals can be something that we see help to improve those reflux symptoms also. Um, and we definitely see constipation a lot in our folks with Down syndrome. I feel like definitely there's some medical reasons that go into that. Like we talked about, maybe it's possible medication side effects, maybe it's related to celiac disease or lower muscle tone. So those muscles not moving foods through the GI tract quite as effectively. But also, just in my work with our folks with Down syndrome, maybe we see folks eating less fiber, so eating less whole grains, eating less fruits and vegetables, so like not getting that fiber nutrient that's going to help to move things through more efficiently. Also, maybe we don't drink as much water, maybe we're not as active. So we see some like lifestyle factors influencing that. I guess maybe Not necessarily like influencing the constipation, but maybe worsening it if it's something that a person is already dealing with. All right. And then this will definitely be more specific to our adult patients, but I feel like on the kind of reverse side of weight management goals, I will get consults for a lot of our patients with Alzheimer's and dementia. As I get referred these patients, typically we'll see decreased appetite, unexplained weight loss. So I might get a referral for weight management, but it'll just be maybe we're looking at ways to promote weight gain or we're concerned about malnutrition versus weight management in terms of overweight and obesity. So something that we see pretty frequently in our adult population, like we talked about things to look for, like behavior changes, unexplained weight loss, highlighting again that since we see so much overweight and obesity, if someone is losing weight, but we don't know the reason why, that it's definitely something we want to look into. We don't just want to always like blindly celebrate weight loss. And as far as like what we can do nutritionally, we can really promote a like nutritionally balanced diet and regular exercise like all throughout the lifespan. We have some evidence to support the use of the MIND diet. Now, this isn't specific to the Down syndrome population. Research done in folks without Down syndrome is where we kind of get this from. But the MIND diet is a combination of the Mediterranean diet and the DASH diet. So, really encourages like high consumption of fruits and vegetables, lean proteins, including more fish and seafood, including less sodium in our diet, and things like that has been shown to decrease risk of developing Alzheimer's and dementia later in life. So even our patients that I might see in clinic and they're like, I don't have any nutrition concerns or I don't have anything to talk to the dietitian about, I'll usually at least put in a little bit of a plug for, well, here's a way of eating that's more preventative. Even if you don't think you have any concerns now, here's some things to maybe consider as we think about, having a long, healthy life. And also, we'll see that MIND diet, those kinds of recommendations will go hand in hand with recommendations for weight management goals as well. Okay. Yay. That was really all I had today. Just to highlight a few of the things that I think were super important here today is that there is a role for a registered dietitian in, helping a person with Down syndrome independently care for their personal health. And that working towards nutrition goals is not something that's going to be solved in one visit. It's going to be something that, we really work on over time to ensure that the person can be successful with lifelong lifestyle changes. So if you do have interest in working with a dietitian, that is a highlight you will probably see a lot of me, and that's to be expected. But also highlighting again that to be successful with nutrition and lifestyle changes, we really want to understand what is important to the person with Down syndrome themselves instead of, focusing so much on what our reasons are or what we think that they need to do better. So asking them what they think and what's important to them. All right. Wanted to save some time for questions if we have any.
Thank you so much, Shannon.
Yeah. I talk
Um,
so much and I feel like I talk really fast. So if we have questions,
that
please
was
feel
wonderful.
free.
Someone in the comments, Kathleen asked about IBS. Do you have any comments on that?
Yeah, so I have a few of our patients that I see with IBS. It's not something I feel like I see a ton. Um, as we work for, like I would say, like the patients that I have with IBS, usually how we address that is we'll do some kind of like food and symptom journal where I'll have them like write down what they're eating, write down what symptoms they have I usually try to get it for at least 2 weeks so that we can get a good idea. But I think that that is usually where we start as far as like identifying like what foods are specific triggers. And then usually we'll work pretty closely with like medication management of that as well. So like if it's IBS-C, like more constipation driven, I feel like when I've seen IBS in our patients, that's usually what it is. It's more like a constipation, like predominant IBS. So working with like medication management of that, because there's like supplements we can try. There's like, as if it's fiber supplements or there's other forms of supplements too, depending on the person and, what symptoms they're having. having. So thinking like medication management, working with the doctors, and identifying like what those trigger foods are is usually how we approach that. So not something we see super commonly, but definitely something we see. Do you have any other questions? Going once. Going twice? If we don't have any more, that's okay. Or if we wanted to look in here.
Oh, hey, Shannon.
Hi,
Hi. I,
Kathy. I
I
thought
was
I
the
saw
one,
you in there.
yeah, I came late because we were having a 90-day review of Teresa's care. Um, I submitted that question about IBS, and I guess my follow-up question is, if you do know, can you put me in touch with those families so that we could maybe form a little support group, families whose loved ones have IBS? I mean, you don't have to you know, release any personal information, but you if you could connect with them and tell them that I would love to um, talk to somebody. I guess I need a support group. of,
Yeah, no, I think that that's a good idea. I love that you brought that up. Well, we can definitely talk about that more too. No.
okay, yeah, you and we can talk about that,
Oh
right?
yeah. Well,
Some
yeah,
other time.
absolutely. Yeah, definitely. Get
Okay.
together.
All right, thank you. And will this show will this program be available for replay because I missed I'd like to recommend it to others, to some of Teresa's caregivers to um, watch or listen to.
I'll have it up on our website, our DSAP website, by tomorrow. So you'll be able to
Which,
replay it.
I'm sorry, which website?
The DSAP website, it's dsapgh.org. So it'll be on there starting tomorrow.
Oh, thank you very much.
Sure.
Yay. Thank you, Kathy. All right. And then any other questions, comments, things we think?
I'll jump in if that's okay. Hi, Shannon.
Yeah. Oh, hi. Oh my gosh, it's so good to see all of you today. All my peeps are here.
You too. I just wanted to say thank you. And for anybody that's thinking about like reaching out for Shannon services, we've had great success so far with Reese. We had given up on feeding therapy because we were making no progress, and the food chaining and the very small changes have really made some big impacts. He has a lot more interest in food, and I love the collaboration with Shannon, just brainstorming and tossing out ideas. Like we would leave feeding therapy like deflated, like, oh, nothing's working. But this has been a really good experience. So I just wanted to share my positive experience that I've had here. And thank you for all that you do.
Oh, thank you so much, Carrie. That's like incredibly sweet of you to say. And I
I
know like,
No,
second that.
oh, thank you. Yeah, I know we've talked about Reese. He's a rock star. He's trying all kind of stuff. He's doing great. And Teresa, she's like, we go way back.
Yeah.
So thank you both. That's very sweet of you to say.
Shannon, we had a question in the chat from Robert of where you can buy a portion plate.
So that portion plate that I showed that had the pictures on it is from the USDA My Plate. So I want to say they either have them on like if you go to like the USDA My Plate website, they're either linked there, or I think I might have even got that one off of Amazon. So if you go on to Amazon and just search like portion plate or like visual portion plate, it should be something that's like pretty easy to find on there. It's a good question. As far as like other resources too, I don't think I highlighted anything in here. We recently did a whole nutrition page on the NDSS website. So that is available now. I want to say that just happened like a couple months ago. So if you're looking for more resources, maybe I can send that to you, Charisse. All kinds of links and all kind of stuff on there as far as like additional resources. So that's something that's pretty new. And then I've also been on Dr. Velodi's podcast a couple times. So if you're interested in learning more about all kinds of nutrition related topics, I have a couple podcast recordings on there. Or if there's ever anything that we're interested in learning about, as you've seen today, I can talk a lot. So I'm more than happy to talk about anything that we want to learn about. All right. Any other questions or other stuff we were thinking? I did just have one more thing that I wanted to share with everybody while we're here. So at the Down Syndrome Center, we have a nutrition student from Pitt that is interning with us for a few weeks, and she is going to be presenting on the Mind Diet that I briefly alluded to in our talk today. So as far as like dietary recommendations for, you know, helping to prevent Alzheimer's dementia and also like weight management recommendations. She's going to be presenting a little bit more in depth on that, and that is going to be, let's see if this will let me scroll down. Going to be taking place on Wednesday the 10th at 5:30, and that will be another thing that is virtual. So more to come on that. I don't think we have registration set up, but yeah, looking forward to having Beth present. So just be on the lookout for that. All right. I think that's
Thank
about
you
all
so
I
much,
have.
Shannon, for presenting all this great information today. And we look forward to Beth's presentation in September. And like I said before, this will be on our website, dsapgh.org, starting tomorrow, so you can rewatch or share. And if you registered for this event, I will send it to your email as well, so you have access to it. And then I hope to see you all at the Buddy Walk on October 18th from 11 to 2 at Hazelwood Green. And thank you so much for everyone for attending.
You bet. Thank
Yay. Thank
you.
you,
Sorry.
everyone.
Goodbye, everybody.